Self-catheterization manual for men. Let's learn together so you can master self-catheterization. If you have difficulty urinating for any reason, self-catheterization is one way to help. Self-catheterization is a method of inserting a tube called a catheter into the urethra to urinate when urine has accumulated in the bladder. What happens if you can't urinate? Normally, urine is produced in the kidneys and flows through the ureters to the bladder. When a certain amount of urine has accumulated in the bladder, it is discharged from the body. If you become unable to urinate, your bladder becomes full of urine. As a result, the pressure inside the bladder increases, causing the pathways from the kidneys to the ureters and from the ureters to the bladder to become congested, which swells the kidneys and causes functional impairment. What are the benefits of self-catheterization? Protection of kidney function. Regularly emptying the bladder through self-catheterization can protect kidney function. Improvement in bladder function. Bladder function may improve because self-catheterization can replicate the bladder's natural movement of storing and then expelling urine. Lower risk of urinary tract infection. Even if bacteria enter the bladder during catheter insertion, emptying the bladder at regular intervals can prevent urinary tract infections. Resuming social life. Unlike living with an indwelling urinary catheter or a connected urine collection bag, self-catheterization does not impede body movement, so it is possible to participate in work, school, and travel. Starting self-catheterization. The most important thing is to continue doing it properly. Be careful not to let too much urine build up in your bladder and make an effort to catheterize regularly. Required items. Catheter and case. The case allows for compact storage. Disinfectant solution. This is needed to disinfect the catheter. Cleansing wipes. Use these to wipe the urethral opening when urinating. Convenient items. Lubricant. Applying lubricant to the urethral opening or the tip of the catheter makes it slippery and easier to insert. Urination diary record. This is very useful for diagnosis and treatment. Measuring cup. This is convenient for measuring urine volume. How to perform self-catheterization. Wash your hands. First, wash your hands. If there is no place to wash them, use a wet wipe to clean your hands. Position yourself. Lower your clothing and get into a position that makes it easy to insert the catheter. Clean the urethral opening. Grasp the penis with one hand and, with the other, wipe the urethral opening with an alcohol swab, tracing a figure-of-8 motion from the center. Prepare the catheter. Take the catheter out of its case. Hang the case on a hook in a convenient place, such as on a toilet door or a toilet paper holder. If necessary, apply lubricant to the catheter. Insert the catheter. Hold the penis with one hand, lifting it slightly. Relax and, in rhythm with your exhale, slowly insert the catheter into the urethral opening. Remove the cap from the catheter and insert it into the urethra. Urinate. Wait until the flow of urine stops. After it stops, pull the catheter out a little bit, as more urine may come out. Pull it out little by little to ensure no urine remains in the bladder. Clean the catheter. After urinating, slowly withdraw the catheter. Wash the catheter with tap water. After thoroughly washing the inside of the catheter, put the cap on and place it back into the case containing the disinfectant solution. Make sure the case and cap are closed tightly. Important precautions. Timing of catheterization. If you can feel when your bladder is full, catheterize at that point. Since bladder capacity varies from person to person, keep a record of your urination and discuss the safe amount of urine to hold with your doctor. If you cannot feel when your bladder is full, plan to catheterize at a set time. Discuss and plan with your doctor the appropriate daily urine volume and catheterization times. Fluid intake. When you drink fluids such as alcohol or tea, a lot of urine is produced and the bladder fills up quickly, so you should catheterize sooner. Hygiene. Take a bath every day to keep your body clean. Adjust your fluid intake so that your daily urine output is between 1,200 and 1,500 milliliters to avoid increasing the frequency of catheterization too much. Handling abnormalities. If you experience blood in your urine, a fever, or back pain, consult your doctor. Catheter management. After use, wash the inside of the catheter and store it in a case with disinfectant solution. The disinfectant solution should, in principle, be replaced daily. Follow your doctor's instructions regarding the type and concentration of the disinfectant solution to use. Doctor's instructions. Follow your doctor's instructions regarding the method of use and precautions. If you feel abnormal resistance or pain during catheter insertion, please take appropriate action under the guidance of a doctor. Create Media Company Limited.